Hello, everyone. I'm just going to wait as the room populates. Thank you so much for joining. My name is Chase Strangio. I am the Deputy Director for Transgender Justice at the American Civil Liberties Union, and we are here today on the day of what I feel is going to be a critical inflection point in the movement for trans justice. This afternoon, the Arkansas State Senate will be voting on HB 1570. This is a bill that would strip away healthcare from transgender young people in Arkansas. It would open the door to insurance-based discrimination against all transgender people across the state of Arkansas. And it would be the first and only bill of its kind to ever pass. And we know that right now there are many bills like this pending in state legislatures around the country. And we want to do whatever we can today to call on the Arkansas Senate not to pass this bill and to call on Governor Hutchinson to veto this bill should it reach his desk. I personally, as a trans person, as a parent, I can't stress enough how devastating the consequences would be. And I'm so grateful for all of the work that people have been doing in Arkansas and around the country to try to raise awareness to what's happening. And we have an incredible group of people here today who is going to speak out about why this bill, HB 1570, is so dangerous and why the next 24 hours are so critical in our fight to defend trans lives. So I will be emceeing and I will introduce each speaker. We will have times for questions at the end. Please use the Q&A function. The chat is currently disabled, so we want you to use the Q&A function. We will get to those at the end. And thank you so much for joining us and for being part of the fight to defend the lives of trans young people in Arkansas and across the country. So I am going to kick it over to Dr. Lee Beers. Dr. Beers is the board president of the American Academy of Pediatrics, and we are so grateful to have Dr. Beers with us today. Turning it over to you.
Oh, well, thank you. And hello, everyone. As you said, my name is Lee Beer, Dr. Lee Beers, and I'm really honored to be here today as the president of the American Academy of Pediatrics, or AAP, representing 67,000 pediatricians and as always advocating for all children. With alarm and dismay, pediatricians have watched bills like HB 1570 advance through state legislatures across the country. This bill is harmful in two ways. One, it threatens the health and well-being of transgender youth. And two, it puts politicians rather than pediatricians in charge of a child's medical care. Let me first explain how the bill harms transgender children's health. Even before the pandemic, which has had staggering effects on children's mental health, transgender youth had statistically higher rates of depression and suicidal ideation. Around half of transgender youth consider suicide and a third attempt it. New research also shows that transgender and gender diverse youth are experiencing substantial negative mental health impacts from the pandemic at higher rates than their cisgender peers. The AAP recommends that youth who identify as transgender have access to comprehensive, gender-affirming, and developmentally appropriate healthcare provided in a safe and inclusive clinical space. The bill advancing through Arkansas's legislature not only ignores this recommendation, but undermines it. Best practice medical care for transgender youth simply delays puberty until young people are old enough to make their own decisions about their lived gender. This bill would take away their choices by preventing transgender youth from receiving evidence-based medical care. Transgender children have the best chance to thrive when they are supported and can get the health care they need. This bill allows neither. Second, this legislation would allow policymakers rather than pediatricians to determine the best course of care for our patients. Evidence-based medical care for transgender and gender diverse children is complex. As pediatricians, we know how to take care of our patients, but under this bill, doctors and medical professionals would be penalized for doing so, or for even referring patients for gender-affirming care. Doctors would be forced to violate existing standards of medical care for transgender youth, standards endorsed by the AAP and other leading medical authorities. In pediatricians' exam rooms, caring for transgender children and the conversations that followed did not look any different than any other routine interaction we have with families. Politics plays no part in these discussions. It is therefore unfortunate and dangerous that this bill has politicized medical care and that the people most likely to suffer as a result, transgender children and teens, are not consulted or prioritized. Transgender children, just like every child, just want to belong. I hope that by hearing all of us speak out for them today, they know that they do. But the most important way to convey that message would be for the Arkansas State Senate to oppose this harmful bill before it makes its way to the governor's desk. This is discrimination by legislation, and transgender children, and indeed all children, deserve better. Thank you very much.
Thank you so much, Dr. Beers. We are now going to hear from brilliant actor, activist, and just leader in the fight for trans justice, Laverne Cox.
Good morning. Thank you so much, Chase. Thank you, Dr. Beers. I have to say, I'm exhausted. I'm exhausted, really. We are, as we all know, we're experiencing a global pandemic. 2020 was the deadliest year on record for transgender people. Folks are just dealing with a lot of things right now around food insecurity, housing, employment, etc. And there have been a plethora of bills introduced in state legislatures all over the country targeting children, targeting transgender children. It's exhausting. It's so important for me to remind all of us that I encourage us to look at this in the context of years-long attempts to stigmatize and further marginalize trans people and have that stigma codified into law. This is not new. We've seen bathroom bills, we've seen other bills in previous years, and now we see these bills like HB 1570, which would criminalize doctors providing healthcare, medically necessary healthcare to children. It just seems so insane and so ridiculous that we even have to have a press conference to urge the state Senate of Arkansas not to pass this law, to, if it does pass, to urge the governor of Arkansas to veto this bill. It seems so insane. But what I see in the media are efforts to dehumanize and stigmatize trans folks, to objectify us and reduce us to our bodies and medical procedures. And I have to say, I've been reticent to speak out about this, honestly, because I'm tired. And I don't want to have conversations with and about trans people that dehumanize us. I want to celebrate the beautiful humanity of trans people. I've had the privilege before this pandemic to have traveled all over the United States and internationally. And I've met transgender children and their parents, and their parents have been so grateful to have representation of trans folks in the media. And they've been so happy that their children can have access to healthcare when they do, and that healthcare has been life-saving. I've met so many young people who've said that access to healthcare has saved their lives. And when we deny that access to healthcare to trans youth, we know that there are higher rates of suicide, higher rates of depression. So we cannot do this to our children. Trans is beautiful. The humanity of trans people is beautiful and should be celebrated. We should not be talking about the conversations I've seen happening around trans young people are just deplorable. Can we just remember that these are human beings, that they're people, and that any decisions about the healthcare of trans youth should be made between that transgender young person, their parent, and their doctor. The government has no place in these decisions. I implore the Senate of Arkansas not to pass this bill. And if it is passed, I urge the governor to veto this. And I also want to say that I'm also from Alabama. There's a bill pending very similar in Alabama that would do the same thing. Please, please, please stop. If you can, amplify this and let everyone know that this is happening. I know that if people know this is going on, they'll do everything they can to make sure that our children are protected. Thank you so much.
Thank you so much, Laverne. I think it's so important that we just recognize how painful this is for all the trans young people and all the trans adults who are continuing to have these conversations. And I'm just so grateful for you, for your voice, and for all of the folks in Arkansas who are continuing to have to put themselves out there to defend their basic humanity. I'm going to turn it now to Rumba to speak from Intransitive, one of the trans-led organizations that's been leading this fight on the ground in Arkansas. Turning it over to you with just so much love and gratitude for all your work.
Oh, okay, there we go. Thank you. My name is Rumba. I'm from Intransitive. We're a trans organization here in Arkansas. And it's really painful to see that people with power over our lives are continually choosing ignorance to target women and children. I know every trans Arkansan that I know is hurting because of these bills and all of the other ones that they have introduced. We need trans siblings and our trans allies outside of Arkansas to help shine a light here. We need you all to help us elevate our voice and put pressure on Governor Asa Hutchinson. As Intransitive, we want every trans kid in Arkansas and every trans adult to know that we're working and strategizing around the clock to fight these bills. We've been here before this legislative session, and we will be here for you after. To every trans kid, know that it is a fact. It's a fact that you were born blessed. Being trans is a blessing. And it's a blessing that scares people who are born without it. Because we break every binary they've constructed in order to hold on to power. Please remember that our trans sisters are with us. They fought for us to be here, and we will fight for you until the day your blessing is no longer seen as a threat. Please don't give up. Thank you.
Thank you so much, Rumba, and just calling on all of our transcestors who we know are with us. And you know, it's just so powerful to know that you and so many other folks in Arkansas are fighting for trans young people, and we will do whatever we can to support you today, tomorrow, next week, next month. So thank you, thank you. I am now going to turn it over to Joanna to speak about her experience as a parent.
Hi. First of all, thank you so much for having me here today. Like Chase said, I am the mother of one of these brave transgender youth here in Arkansas. I have been successfully parenting Dylan for 15 and a half years now. I've had to make tough decisions over those years for him, always thinking first of his safety and well-being. The decision to seek gender affirming medical care was no different, and I didn't make that choice lightly. I supported him from the moment he came to me and told me that he was transgender. Even so, after he came out to me and after many conversations with him, I sought the advice and expertise of medical professionals. The idea of consulting lawmakers never occurred to me because they should not have a part in these decisions. I did my research, I educated myself on our options and thought long and hard on what I felt was in his best interest. Today, after 2 years of therapy, doctor's visits, and almost 18 months of gender affirming hormone therapy, Dylan is happy, healthy, confident, and hopeful for his future. His outside now matches how he feels on the inside, and he is a support to other LGBT kids. Trans girls are girls, and trans boys are boys. Denying them access to gender affirming healthcare is denying them the right to be themselves. My son will be devastated if he is forced to stop his hormone treatment. all of the progress that he has made, all of the plans to be able to graduate from high school and go off to college, presenting outwardly in the full expression of how he feels on the inside, would come to a screeching halt. It would be heartbreaking, not only for him, but for all the other trans youth in Arkansas that depend on this care. They say that they will still have access to therapy, like that's enough, but therapy alone is not enough for these kids. No amount of therapy will help them when they realize that the government that seems to oppose their existence is now in control of their bodies. I will be terrified for not only my son, but for all of the kids. By passing this bill, they are telling me and other parents that they don't trust us to make the right decisions for our kids. They're telling me that they, who don't know me or my son, somehow know better what he needs. We are asking them to stop this nonsense and to allow medical professionals, parents, and patients to make these decisions. We all just want to be comfortable in our own skin, cisgender or transgender. Forcing these kids to live in a body that looks and feels foreign to them is just cruel. Please, please, please encourage everyone to speak out and just to make this stop for all the kids in our state. Thank you.
Thank you so much, Joanna. I am now going to turn it over to Dr. Burr to speak from the medical perspective in Arkansas.
Hi, thank you so much for having me today. I'm Dr. Natalie Burr, and I'm a general pediatrician in private practice in Arkansas. As pediatricians, we strive to make our offices a safe and inclusive space, a place where patients and families can feel confident that they have access to unbiased, evidence-based medical care throughout all of childhood. House Bill 1570 is in direct opposition to this goal. As a general pediatrician, I make referrals to medical specialists every day. Many of my patients have complex medical concerns that require a team of medical specialists and mental health experts. Part of my job as a general pediatrician is to coordinate that care. I never imagined that it could one day be illegal for me to refer one of my patients to appropriate care. This legislation undermines the physician-patient relationship and asks me to make a decision between obeying the law and doing the best thing for my patient. This bill is putting in place new barriers to youth accessing healthcare in Arkansas. Unfortunately, the youth of Arkansas face many real and serious challenges, things like food insecurity, unsafe housing, increasing rates of anxiety and depression, not to mention all of the repercussions of the COVID-19 pandemic. I would love to be here today commending our lawmakers for spending their time and energy focusing on some of those issues and not having to defend the healthcare rights of a marginalized and vulnerable group of patients. House Bill 1570 has not even become law, and it's already harming the transgender youth of our state. I've heard from local colleagues that just since this bill passed in the House of Representatives, there's been an increase in ER visits for suicidal ideation and attempts in our transgender patients. I dread the day when I get a call that one of my own patients has harmed themselves. To the transgender youth of Arkansas, you are seen, heard, and valued by your pediatricians, and we will fight for your right to access to appropriate and gender-affirming care. Thank you so much.
Thank you so much, Dr. Burr, and thank you for caring for and loving the trans folks in Arkansas. I know that it means so much to them and to all of us around the country. We're going to turn it over now to Evelyn Rios Stafford.
Thank you, Chase. I wanted to speak today as Arkansas's only openly transgender elected official. And I'm a local elected official. I'm not in charge of making these decisions, unfortunately. And there is no one at the table who's trans. The Arkansas state legislators who are pushing this are making decisions about us without us. They are not listening to trans people and their families. And I'm here to say today that you need to listen. This legislation is a national embarrassment for Arkansas. We are better than this. The legislators who are pushing this are not doctors or experts in this field. You do not know better than the experts. We are in a state where 24% of students live in poverty, and we know those numbers have increased since the pandemic. But instead of focusing on these big issues, a small group of legislators has decided to push these bills and focus instead on punching down on trans youth and putting their health and their lives in jeopardy. As a local elected official, I know that our local governments and charitable foundations have spent tens of millions of dollars working to try to make Arkansas a more welcoming place, working to attract businesses and good paying jobs here, working to attract world-class sporting events like the Fayetteville Cyclocross Championships. But bills like this throw all that hard work down the drain. Bills like this send the wrong message to the rest of the nation. This bill sends the message that Arkansas is not a welcoming place. I'm hearing from trans people who are wondering whether they need to move out of the state. This bill sends the message that if you relocate your family here for a good paying job and your child is trans or gender nonconforming, that the rug could be pulled out from under you at any moment. Today, it's trans young people. Who will it be tomorrow? If Arkansas truly values diversity, equity, and inclusion, this bill should get rejected. The legislature and our governor need to decide whether it's more important to score points in some sort of imaginary culture war against children and their families, for our governor to destroy his own legacy and to end up being known for leading hate in our state. Or is it more important to secure Arkansas's economic future and the health and well-being of our young people? My message to trans youth is that we are here and we are not going to stop fighting for you. We call on the Arkansas Senate to vote no on HB 1570 and for Governor Hutchinson to veto this harmful bill if it reaches his desk. Thank you.
Thank you so much, Evelyn, and thank you to all our speakers. We heard so much today about just the unbelievable human toll of this bill, even as it's just been introduced, just been debated. We have young people who are struggling, who are afraid to lose the healthcare that the American Academy of Pediatrics, that pediatricians throughout Arkansas know to be life-saving and medically necessary. And today, we're all calling on the Senate to stop this bill from ever reaching Governor Hutchinson's desk. But should it reach your desk, Governor, please veto HB 1570. And the final thing I want to say before we turn it over to questions is that we will absolutely sue you if this bill passes. It violates the Constitution. It singles out a group of young people solely because you do not understand them and because you find them to be politically unpopular. It violates federal civil rights statutes. The litigation will be costly and it will be painful for the young people who will have to endure it, but we will be standing with them and fighting alongside them. And we will take this to court as soon as we have to and as fast as we have to ensure that no young person in Arkansas loses their care that we know saves their lives. And I hope it doesn't come to that, but we will absolutely keep fighting no matter what, whether it's tomorrow, whether it's the next day. We will see you in court if we have to, but please don't pass this law. Please think of the trans young people who need this care. At this point, I think that we have closed out our speaker list and we are available to answer any questions. Just to remind everyone, this has been recorded and will be made available if you email media@aclu.org. We can send you a recording. But if there are any substantive questions for any of us, we're happy to answer them now using the Q&A function.
All right. Chase, our first question is from Andrew DeMello at AP in Arkansas. If we have more information on how many other states are considering similar legislation.
Yeah, so unfortunately, there have been a record number of anti-trans bills filed around the country this legislative session. We know that on Friday, Governor Hutchinson already signed the anti-trans bill that bars trans girls from sports, and many other states are considering similar legislation. When it comes to HB 1570, I cannot stress enough how this is a completely anomalous and expansion of anything we've ever seen in US law before. So there has never been a law like this that has passed and been signed into law. So Arkansas would be the first if that is what happens today. There are other states considering similar legislation. As Laverne mentioned, Alabama could be set to vote this week on a bill that, like HB 1570, would bar healthcare for trans young people. The state of Tennessee is also considering a similar bill. But the majority of these bills have died, the ones targeting healthcare for trans youth. Lawmakers have recognized that they will have blood on their hands if these bills pass. It is as simple as that. So we currently have about 3 of them pending: Tennessee, Alabama, and the one that is moving quickest and will be voted on today, which is Arkansas's HB 1570.
Thanks, Chase. Our next question is from Alicia Alt, I believe from Medscape, and her question is, what are the penalties that physicians would face, and has the American Medical Association weighed in on this? And that's Medscape Medical News.
I'm happy to answer it unless either of the doctors want to. Dr.
Jace, if you want to talk about the penalties, I can follow up on that. No, why don't you start and I can follow up.
Okay, so in this bill, the Arkansas bill opens the door to civil penalties and licensure penalties to providers who treat trans youth. So as both Dr. Beers and Dr. Burr were explaining, this puts physicians in a position of having to either meet their ethical obligations as physicians to their patients, or to violate state law, which could compromise their medical license altogether. The Alabama bill, in contrast, has a criminal punishment, so it would be a felony in Alabama to treat young people consistent with the medical standards. But either way, what we know to be true is that by passing a law like this, doctors will be forced to stop providing care that is saving kids' lives. And they could lose their license, and they could be otherwise punished. They could have enforcement proceedings brought against them by the government. So that is how the enforcement mechanism works here. So Dr. Beers.
Yeah, no, and actually I'll follow up on that. Certainly we've not seen a bill exactly like this before, but it has come up before in the past of circumstances where, the physician-patient relationship entered, the legislature tried to, or politicians tried to weigh in on that. And I think what's really most important here is that medical professionals and not politicians really need to be the ones to decide what medical care is in the best interest of a patient in accordance with medical best practices. And so any kind of law or any kind of penalty that limits or dictates what a physician, or in this case pediatrician, can discuss or do during a healthcare encounter really is counter to every principle of providing medical care, and I don't think is something that any of us really should see as acceptable.
And in terms of the American Medical Association, every major medical association has spoken out against these bills, including the AMA, obviously the AAP, the Endocrine Society, which has a very well-established and well-researched set of protocols to provide healthcare for transgender young people and transgender adults, Pediatric Endocrine Society, the APA, the American Academy of Child and Adolescent Psychiatrists. There is not a mainstream medical organization in the United States that has not come out in opposition to these bills. And I think particularly in the middle of a pandemic, it is truly jarring that it is a priority of state legislatures to punish doctors for treating their patients consistent with their medical obligations and with well-established standards of care.
All right, again, you can put questions in the chat, in the Q&A box. And our next question is from Eve Howe. Do you think the legal arguments for trans healthcare for minors will parallel those for abortion rights, like the right to privacy? And if so, have you reached out to reproductive healthcare organizations to collaborate? Chase, do you want to take that?
Sure. So I think, yeah, I mean, when it comes to what is actually going on here, when we look at the impulse behind these bills, one of which is to stop people from being trans and to eradicate transness, which is never going to happen, and we will continue to defend and protect our community. I think the other sort of large theme that we're seeing, like in the context of anti-abortion laws and restrictions on access to reproductive health care, is a desire on the part of the government to restrict bodily autonomy and control people's bodies. And so the playbook that we're seeing here is very similar to the anti-abortion playbook, both in terms of how the laws are drafted and in terms of the ways in which they're being pitched around the country. We're absolutely collaborating with reproductive justice organizations in every single state where these are pending, as well as nationally. When it comes to the legal claims, there are some that are similar and some that are different. I would say that the key thing about these laws targeting trans youth in this way is that they are so sweeping and out of step with any rational underlying basis, given how healthcare is provided generally, and then given how much misinformation about trans people is being pushed in support of these bills, that the equal protection argument is so clear on its face that these laws violate equal protection and the equal protection rights of transgender young people under any standard of review. And so there are similarities to how abortion cases are litigated, but I think here we even have more straightforward claims to challenge these laws in court. And as I said, we're fully prepared to do so.
All right, the next question is from Casey Quinlan with the American Independent. Do we have thoughts on why Arkansas in particular has passed or advanced so many of these anti-LGBTQ bills?
Roomba, do you want to do that one? Oh.
Sure. Can y'all hear me? So I would say one reason is that they're they're looking at who can we pick on, and they've chosen to pick on women and children and families, I would say, as we've heard from a parent that also spoke on that. So trying to figure out like who do we pick on next. The Family Research Council influences all of their decisions. They're there at every committee hearing. They reserve every seat that they can somehow. And aside from that, we also know that there's a big group of white supremacists here in Arkansas, and they have been pushing for things like, targeting trans people specifically, banning abortion and everything else. They want to make Arkansas a sanctuary for white supremacists. That's what they've been planning as they expected, Biden to be sworn in as president. So they wanted to buckle down on Arkansas as much as they could, and and in the process try to make this sanctuary where white supremacy can thrive. So I would say those are the two reasons that come to mind for me. One is the Family Research Council is behind all of these politicians that are pushing these bills. Who knows how into their paychecks they are or whatnot, but they're there at every hearing. And the other is the white supremacist groups here who we tried to track, and they have been pushing this idea of making Arkansas a sanctuary for white supremacists way before even the election started. And who best to pick on than women and children? They're coming after everyone who needs access to abortion, and they're coming after everyone who is viewed as more vulnerable to push their agenda.
I think also Ruma made such an important point about how these bills are not coming from Arkansans. These bills are not constituent-driven pieces of legislation. They are being drafted by groups that are nationally and internationally funded and run, that are drafting these bills and targeting states where they're able to exploit existing political dynamics to harm groups of people, as Rumba said, that are, politically marginalized and in a national conversation in states that don't have the resources and funding of other states, which is why this is so important that we see this as a national effort to fight for trans lives, to resist a national and international effort to eradicate trans lives. These bills were not drafted in Arkansas. They were not originated in Arkansas. And ultimately, we have to bring all of the resources to bear to fight what is an incredibly well-funded global movement to attack us. I think we're going to take 2 more questions and then close out.
That sounds great. Chase, we did have a question from Patricia Rodriguez in Arkansas. She lives in Arkansas. I called both my state representatives and the governor's office stating my opposition to these transphobic bills. I've donated to trans-led organizations in my state, and I've asked friends and family to do the same. What else can I do?
I mean, I would turn it back over to Rumba, because I defer to folks in Arkansas in terms of what we can do to support you in this moment. Obviously, continue to share this information, but Rumba, what else do you all need?
We need to put pressure on folks who are outside of Arkansas too, folks who have large platforms. So just tweeting, like retweeting, commenting on their things, like tagging them on things. Because we know, and as Chase mentioned, a lot of this is coming from out of state, right? And a lot of our voices here in this state are not being heard. I mean, we had 16 people come and testify against the bill and like have time, their time was limited, whereas everyone the Family Research Council put got to speak for as long as they wanted. So we need that support from folks outside. So I would say, like every time you share, every time you comment, every time you saved any of our posts, then it gives it more boost. Every time you retweet, it just boosts it so more people can see it. More people can also make calls and put pressure, but also trying to get, people, corporations like Tyson and Walmart, who were born, created in Arkansas and have a lot of power to, make, to move politicians. So trying to put pressure on those 2 organizations to come out and express their support publicly, and then folks who have large platforms outside of the state. So artists, athletes, other corporations. I know Costco is coming to Arkansas to invest. They're going to open up a Costco for the first time in Little Rock. So asking Costco to also speak on it. These bills are going to be harmful to the economy, and so folks should be speaking up against it. So yeah, trying to get people with large platforms, corporations with large platforms, to also speak up against it.
Yeah, and I think the last question is about what's going to happen to kids if this becomes law and we don't have a way to stop it immediately in court. What's going to happen to people who need this healthcare? And I think that is a big, scary, open question. We know that this is ongoing care, so we can't have people simply leaving the state for a one-off day at another doctor. There are going to have to be incredibly innovative and creative solutions to keep people alive, but no one should have to flee their home. Many people cannot flee their home for financial reasons, for other reasons. And so we're in a situation where we should be doing whatever we possibly can in this moment to prevent that eventuality. We don't want people fleeing. We don't want people buying healthcare off of Black markets that is unregulated, that's unsupported. But as we know, when states step in to ban healthcare that people need, that it doesn't mean that people stop getting the healthcare. It means they stop getting it safely. It means they stop getting it from their doctors. And so right now, we need to be very concerned about what's going to happen to all the young people who may have been relying on this care for 5+ years to have it immediately cut off from them. And we will find a way to care for them. We always do. The trans community has been taking care of ourselves and each other for a very long time. But this is incredibly dangerous from a medical perspective. It's incredibly dangerous from a population-based perspective. And so hopefully we can urge the governor to veto this bill if it reaches his desk, so that he doesn't have to look at the consequences of what his state has done, and so that we don't have to worry that kids are not going to get the healthcare that they need to survive. I mean, I don't know if either of our medical providers wants to add to that, but I think it is incredibly nerve-wracking. Or Laverne, maybe you do too.
Chase, you make a really important point, I think, around, because for a very long time, I'm 48 years old. I started my medical transition in 1998. And I did it in New York City, and there were very few doctors that you could go to in 1998 and get healthcare as a trans person. And most of the trans people that I knew at the time were getting hormones from the streets, from like just random people, and weren't getting their blood work checked, weren't doing all the things to make sure that were doing their transitions in a healthy way. And that led to not always the best outcomes for them in terms of healthcare. So it's really important now that there are more doctors and more healthcare professionals who are treating trans people, that trans folks, when they decide with their parents that they want to have gender affirming care, that they're doing it under the supervision of a doctor. There are times when trans people did not have access to that, and the consequences and the outcomes weren't always the best ones. So we don't want to go backwards. We want to keep moving forward when it comes to healthcare for trans folks.
Yeah, especially when we have young people who may have been in such extreme distress, and then they got the lifeline of this care. It's hard enough to feel like the care is never available to you. Imagine what it's going to be like when you rip it away from people who have that hope, who paused their puberty that is causing them such severe and significant distress, and just forcing them to undergo physiological changes that they simply cannot manage and regulate internally, while their parents are trying to love and support them, while their doctors are trying to care for them, and the state is stepping in and stopping all of that. I mean, this is truly catastrophic.
Catastrophic and inhumane.
Dr. Beers, Dr. Burr, do you want to add anything?
I'll just briefly add, especially during, at any time, but especially during this time where healthcare access can be more limited because of the pandemic. We should be doing everything possible to increase access to care for all of our patients, and this is no different. And any attempts to limit access to care really just, as I said, are just unacceptable. And we should be working to increase access to care for everyone, and not putting barriers up where they don't need to exist and shouldn't exist. Dr. Burr, you may want to talk about your local experience.
Well, I would just say that, as a group of pediatricians in Arkansas, we were really excited and are really happy that our patients have been able to have these services in our state. One thing that really stands out for me about this bill is it not only wants to take away that type of care, it also would say that I can't refer for that care. So even if that wasn't an option in Arkansas, that really limits conversations I can even have with families about where they can go for care. Can they seek it somewhere else, which they shouldn't have to? And so that, for me as a general pediatrician, is really disheartening to see that legislature really wants to control even the conversations I have with families about children's care. And so I agree with everything else that everyone else has said about, what happens when we make access to care more difficult, but also just, what happens in our exam rooms when we're told what we can and cannot discuss with our patients as well.
And that is definitely a violation of your First Amendment rights. So we will also be sure to include that in our lawsuit. Does anyone want to make any final remarks before we close out? I'm just so grateful for everyone's time and advocacy. And we know that the legislature will be convening shortly, and we will be monitoring and organizing and fighting every step of the way.
If I can really quick, kind of go back to one of the questions earlier where somebody asked, what else can they do on top of calling and writing? Reach out to your friends and family that are being directly affected by this. We are not okay. We are scared for our children. We're scared about what we're going to need to do moving forward if this sticks. So reach out, let people know that they are loved, that they are heard, that they are seen, and that one way or another, everything will be okay. Because as a parent of one of these kids, it's pretty terrifying to not know what's going to happen or what we're going to have to do.
I think that's a good point to end on. Make sure you tell everyone that you love them and that you care for them, and that we're here as a collective, and we've been organizing for ourselves and each other for generations, and we will continue to do that. So thank you all, and we can make this available to anyone who needs it. So I hope everyone has a day that involves us stopping this bill. Thank you. Bye, everyone.